I did make it on time. I'm so glad. Come on. You're going every page but where I want you to go. Let's be friends. Come on. Hi, everybody. I feel like my whole day has been waiting for computers all day long. Let's get it going. Let's get together here. Ah, there we go. Now we're cooking with grease. Okay. Alrighty. Now I can finally get in. Alright, I hope y'all are ready for study hall. Make sure you have your questions. Alright. Hi Ashley, hi Shannon, hi Marissa, hi Hannah, hi Byron, hi Edel. Thank you all for joining me. I appreciate everybody being here. Thank you guys so much. It is Monday, and it feels like a Monday. Alrighty, so let's go ahead and get going. Alright, this is Study Hall Monday. I know I normally do this on a Thursday or Friday or so, but I thought switching it up would be a good thing for you guys. So if you are brand new to my channel, welcome. I am Blue, I'm a medical coder, and today we are doing a study hall. I am going to be discussing the very elusive Z09. So Z09 is the follow-up code, and a lot of people have questions about when do you pick up this follow-up code and how is it properly applied when you are coding. So I will be discussing this. If you guys have any questions about this or the history codes, then please be sure to comment in the chat box and I can go ahead and answer those while we're all here. So let us begin. Okay, Z09, that is the follow-up after completed treatment. When would this apply? So in the instance of, I'm just going to use it as an example because you guys know how much I love orthopedics and how much I love podiatry and all of my injury codes. So when a patient comes in and they've broken their arm and they get set into a cast and they fall into that 90-day global period, right? And so for the next 90 days, right? So that's the day before, the day of the procedure, and then, or the surgery rather, and then 90 days thereafter is the total global period. So during this time, this patient with a fractured arm is going to get that 7-digit injury code. So it's going to start with an S, it's going to end with a D on their subsequent visits. Obviously, the very first visit where they're treating that fracture is going to end in an A because that is the initial or the active treatment for that patient. Then as they go through their visits, the subsequent visits, it is going to have that same injury code along with the D at the end for the subsequent visit. Now, what happens when you get out of that global period and the patient is coming back like 6 months later for a follow-up just to make sure that everything is healed properly, they are completely done with their physical therapy because oftentimes the surgeon will send the patient to physical therapy afterwards to make sure that they get proper rehabilitation for their broken bone and they're able to use it and keep themselves well. So in that 6 month follow-up, right? They no longer have this fracture. They've looked for it. It is showing it is completely healed and everything is going great. There is no more treatment required for this fracture, right? So that is when you would not report the injury code, but you would instead report the Z09 for the follow-up, right? This is follow-up after completed treatment. And then you would code for the history of fracture, the traumatic fracture. There's that history code. So that is what you would use to report that follow-up visit where everything is fine. There's no other care that's needed. And this is basically just a visit to make sure that everything is okay. Pretty simple, right? It seems like it's fairly simple to do. The key to remembering when to apply Z09 is when they are out of a global period. They are no longer in this global period anymore. If whatever their condition is requiring them to be in a global period, okay? If it's not requiring them to be in a global period, then it depends on what is happening and what they were treated for and that kind of thing. And if that follow-up visit is indeed a follow-up to make sure that everything is okay. So that is something that you have to look at. When you're looking at those history of codes, there's so many personal history codes. So these personal history codes is where you're going to be able to find these additional type of diagnoses. Now, when you're looking at encounters that are for like a nail removal, okay? Nail removal is another good one because sometimes for these nail removals, they have a 10-day global period on this, right? Obviously, it's not 90 days. But in that 10 days that they are in that global period for some of these procedures that they do on the nail, right? You're going to report the aftercare code. Obviously, you're not going to report whatever it is. Maybe if it's an ingrown nail, you're not going to report that. You're going to report the aftercare following surgery for the skin and subcutaneous tissue and that kind of thing. There's that code. So after you get out of that 10 days, right, that 10-day global period, and say, for instance, they follow up in a month, you know, to make sure that everything is fine, that the nail is not coming in weird, or there's not any other kind of infection going on and that kind of thing. If everything is fine, then that's when you would put that Z09, and then you would put history of skin, diseases of skin or other subcutaneous tissue. There's that one. I'm thinking it off the top of my head, but it's that one for personal history of skin, diseases of the skin. So that is something that you would be able to report there. So that is how you use those follow-up codes. So always remember that even though they're coming in for that condition, if that condition is resolved in the outpatient setting, we do not pick up resolved conditions. We can pick up history conditions, right? History conditions as they are pertinent to that encounter. So in the instance of the follow-up, if they're following up because of that and they no longer have it, you can put personal history of, and there's a whole list of personal history codes. So, hi Mina, hi Jamie. Mina says, is there a place I can go to find that global period, to find out what the global period is for a procedure? Let me see. There is a website. Let me see. And this website, it allows you to put in the procedure code. If I can get my, okay. Global period for CPT. There is a website that you can go to that you punch it in and it'll tell you how many days, how many global days are in that procedure. If you're using the CPT Expert by Optum, it does have those days in that book as well. And I think this is it, the Global Surgery Calculator. Let's see. Is this it? Are you going to be nice to me? Yes? Okay, so let me think of let's see if I'm doing this appropriately. because, you know, I love you guys. I did find it. Okay, so thanks to the good folks at Palmetto GBA, they have a global surgery calculator. Now this little thing, right? I'm going to put the link in the chat box. I'm also going to put the link in the description box after the video. So in order to get to the description box, because some people don't know how to get to that, that's fine. When you see the title of, you'll see my picture, right? You'll see the video playing and you'll see the title, right? Next to that red subscribe button. And if it's, you know, you can hit that, right? Because it's free to hit the subscribe button. And also it's right next to that little thumbs up button. You don't want to listen to the other one, just the thumbs up one. That's the one you want to hit, okay? When you click on that little down arrow, there's like a little down arrow looking thing, and then all the information is in that description box. How to get a hold of me, what my social medias are, it's all there. So I'm gonna leave this link in there, but I'm gonna go ahead and put it in the chat box as well. So it has two sides, just so everybody knows. It has method 1. And then it's talking about enter the date. It's going to give you like the date to calculate like what is the end of that global period. So if it's like on February 1st, it'll calculate how many days for like 90 days and how many for 10 days. Or it'll method 2 that you're actually putting in the procedure code and it'll tell you how many days. If it says procedure same day, that means it's 0 days. Okay. Hi, Ellen. All right, so here we go. Paste. There you go. Keep that. Bookmark that. That is a very helpful website. So I know I've talked about it before, but I don't know why I didn't think about it before to add it in there. But I will add it again after the show, so that way when I update it, it'll be all there. So again, going back to the subject at hand when we were talking about these follow-ups, it's very important that when you're looking at these follow-ups, that you understand what that particular condition is. Like, I know I'm saying the word wrong. It's basically a benign tumor, right? When they remove a benign tumor, adenoma, I can never say it, so I'm not even going to try, okay? But just know that when they have that and they remove it, right, because it's a benign tumor, it's not going to fall under that Z08, because Z08 is just like Z09, except for Z08 covers your malignancies. So when you have a patient that's coming in for a follow-up after a malignancy, then that's when you would use that code. If it is just a regular condition, if it is just a regular condition that they're going through or an injury that they've gone through, that would be Z09. The only time you would use Z08 is when you're looking at malignancies. So keep that in mind. You got to keep them separate. And if the tumor is benign, you're going to go with the Z09. Okay, benign, Z09. Okay, but if it's malignant, then you have to give it the Z08. And not adenoma. It is something else. Adenoma is, what is it? And did I freeze? Did I freeze? Okay. Adenoma. See, even I struggle. No, it's a polyp. Okay, this is the word. And then you tell me if you can say it. Or you can put that thing in there, like how to pronounce it. Did I get out of the... Oh, I did. Really? Was that necessary? You know I was going back to that page. All right. So, all right, Christopher, since you're right here, how do you pronounce this word? I can never get it, because it always like, Or if anybody knows how to say it, let me know. That word that I have in the chat box right now, it means benign. Okay? That's a benign polyp. So again, it's going to go Z09. If it is malignant, then you're going to go Z08. So it's very, again, back to very important that you know when this patient is out of that global period or when they've actually completed all of their treatment. Because sometimes providers will say that if the patient is in the global period of their fracture, right? And they say, well, they're all healed, so they no longer have the fracture anymore. After a couple of weeks, yeah, but they're still in that global period. But you're not going to use that Z09 while you're still in the global period. Because the thing is, anything could happen to that patient still pertaining to that fracture. So that is why it's still healing. It still needs time to heal. So a lot of times they'll say it's still healing or it appears resolved and that kind of thing. So that's where you still have to use that injury code, because that injury code is going to follow that patient all the way through, because all of those visits for that condition are falling under that global period. So that's what you're going to use in those subsequent visits. So just keep that in mind. So does anybody have any questions about Z09 or Z08 for that matter? Ask now. Let's see, what else can I talk about? Since that went pretty well. And that went pretty fast too. Does everybody get it? Yes? You guys are awfully quiet tonight. What is going on, my people? Nothing? You got nothing, Christopher? Let's see what Optum says about Z09. Z08. Adenomatous. I just got here, Ale, and I missed the topic. We're talking about Z09, the follow-up code, when to apply it, when not to apply it. Z09, encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. Medical surveillance following completed treatment. Use an additional code to identify any applicable history of disease code. And so it gives you the range Z86 to Z87. And then it talks about like that it excludes one node and stuff like that. But not so far. It's all right. I think Shannon helped me with it. Adenomatous. Hope I said that right. Anyway, so that is how you pronounce that one. That word means that it is a benign polyp. And again, that's going to fall under Z09 because even though it's a polyp, it's not malignant. So anything that's malignant is going to fall under that Z08. If a patient comes in and they've had a tumor removed that was a carcinoma, in fact it was malignant, then and they're just coming in for just a follow-up and everything is good and they're good to go, then you can use that Z08 and then the history of the malignancy for wherever it was. Mina says, if they are admitted for 2 different diagnoses, would you still use Z09 if only the first diagnosis still exists? If they were admitted for 2 different diagnoses, would you still use the Z09 if only one diagnosis still exists? So if the reason for the encounter is a follow-up for ingrown toenail, right? And their ingrown toenail is totally fine. So then that Z09 is going to be the first listed diagnosis. Then it's going to be your history of skin coat, right? Diseases of the skin, and then whatever other thing they're coming in with. Okay. Or you can put, whatever, whichever one is, Well, no, because it's going to be the Z09. That one's going to be first. So if it's a follow-up, that's what goes first. Does that answer? Does that make sense? Waiting on you. So yeah, that's when you would use that. You would still, okay, so she gets, okay, good. All right. So let's look at these personal history codes while we're still here. Z86 to Z87. Okay, so Z86, personal history of Z86. Z86, okay, covers personal history of infectious and parasitic diseases, personal history of diseases of blood and blood-forming organs, and then certain disorders involving the immune mechanism, personal history of endocrine, nutritional, and metabolic diseases, and then it tells you what conditions it's classifiable to. So if a person has any condition, like in the personal history of endocrine, nutritional, and metabolic diseases, and conditions classifiable to E00 to E88, then you would be able to, if they're coming in and they no longer have that, you could put Z09 and then the history of personal history of endocrine, nutritional, and metabolic diseases. So, you know, those E00 to E88, that covers like your diabetes codes. So that is just some of the codes that are in there. They also have a specific code for diabetic foot ulcer and gestational diabetes. So that's the range that they're talking about there. And then it says Z86.39 is personal history of other endocrine, nutritional, and metabolic disease. So again, all those codes that fall in that range are covered under that Z code. And then we have here personal history of diseases of the nervous system and sense organs, conditions classifiable to G00 to G99 and H00 to H95. So it covers like personal history of infections of the central nervous system. So personal history of encephalitis or meningitis, or and then the other code is the Z86.69, which is personal history of diseases of the nervous system and sense organs. So they have like specific codes, and then they have the general, in that general area codes. So if they fall into that range, that is the code that you're going to be looking at. And then they have the other ones, personal history of diseases of the circulatory system, conditions classifiable to I00 to I99. And it's personal history of, the first one is Z86.71, personal history of venous thrombosis and embolism. Z86.711 is personal history of pulmonary embolism. So if a patient has a pulmonary embolism and they're coming back for follow-up and it turns out that they're okay and they no longer have it, Z09, and then the Z86.711 for a personal history of pulmonary embolism, because they no longer have it, but you can still pick up that they had a history of it. So that is really important that you guys check out this personal history section in the Z codes, okay? Because if it does impact the provider, or it does impact the reason for the visit, you got to be able to know which ones to apply. They also have personal history of other venous thrombosis and embolism, personal history of thrombophlebitis, personal history of transischemic attack, the TIA, and cerebral infarction without residual deficits, that's Z86.73. So again, you know, if they're coming in follow up for a TIA, you know, and they're totally fine, nothing else, they fully recovered, Z09, and then there you go, the Z86.73. They have personal history of sudden cardiac arrest, and then other diseases of the circulatory is Z86.79. And then they have just these other ones, personal history of diseases of the respiratory system, J00 to J99, personal history of pneumonia recurrent, personal history of diseases of the other diseases of the respiratory system, and then the digestive system. So it goes through each specialty basically. So again, knowing what the original code was, what the original condition was, is really great, because then that'll help you to narrow down, okay, it's in this range of codes, so that's the history code that it's going to fall under. So fascinating stuff, isn't it? once you get into the routine of it all, then it will start to make sense. But just keep in mind, you're going to go with the history if they no longer have it, okay? Don't continue to pick up the condition code if they no longer have that condition, okay? Because looking at it, the codes, just looking at the codes and then looking at what was actually documented, it needs to coincide together. So even if it says history and the doctor still selected the active code for it, it's your job as the medical coder to go in and change it and update it to the code that is supposed to be appropriate. Because that's our job, guys. Our job is not to just select the provider's codes at face value. There are some coders that do that because they say, well, that's what the provider wants. If the documentation does not support that application of that code, then you need to educate the provider or change the code. You know, and I don't recommend, if they're constantly doing it, right, you have to pick and choose your battles. First of all, you got to pick and choose your battles. So if you are going through and you're looking at this documentation, you see that a provider is consistently selecting a code that doesn't fit, and you constantly have to change it, you can talk to them and say, okay, I know you keep selecting this code, but do you know there's this other code for this? So if you do, then you can make some headway that way. If not, if they don't want to change and that's what they do, and how dare you tell them, you kind of have to work with them a little bit because it takes a little bit of finesse. Sometimes they don't want to be told what to do. So it really all depends. But I hate it when it shows that I'm frozen on the screen because I feel like weird. I hope I don't look frozen on the outside. Anyway, but that is what you do when you're working with these providers. Okay, don't get on them for selecting the wrong codes when you can change the code just as easy. And sometimes it may be a habit that they do that. So it really all depends. But the culture of the work environment should be that you are willing to talk to them, you're willing to communicate with them, because that's what they need, And my screen is horribly frozen. Does anybody have any questions on this at all? Oh, you guys are really quiet tonight. I normally have a jumping crowd over here. I guess because it's Monday. It's all right. Come on. Even my screen is frozen. Everything is frozen? What's up with this? Well, my screen is frozen and I can't see any questions that are coming in. So I guess everybody gets it. So I hope you all have enjoyed this study hall session on Monday. And if you have any questions about follow-up, leave them in the comments below, because I'm going to go ahead and wrap this one up. And I will see y'all tomorrow for Q&A Tuesday. And thank you guys so much for joining me. And like, subscribe, and share. And I will see y'all again. Bye.